So good morning everyone, this is Renalina Redandoa, one of the reporters of Group 7. So Ms. Leah Suarez tackled about the various options for control of fertility, from contraceptives to abstinence, the effectiveness and contraindications of contraceptives. So now I am discussing or explaining the principles of patient selection regarding contraceptives. And here are the principles of patient selection regarding contraceptives. The principles of patient selection in condoms are it is the best way to protect themselves against sexually transmitted infections, STIs, and unwanted pregnancy. Condoms are a barrier contraceptive made from latex rubber, a synthetic rubber called polyesoprene, or a very thin plastic called polyurethane. For the oral contraceptive pill, it is safe, simple, and convenient way to prevent pregnancy. It also has other benefits like reducing acne, making your periods lighter and more regular, and easing menstrual cramps. For intraurethral device or IUD, IUDs give you great long-term protection against pregnancy. They're more than 99% effective. IUDs are one of the most effective methods you can get because there's almost no way you can mess it up. For the contraceptive implant, it can be useful for women who can't use contraception that contains estrogen. It's very useful for women who find it difficult to remember to take a pill at the same time every day. The implant can be taken out if you have side effects. For the contraceptive injection, the injection works by preventing the ovaries from releasing an egg each month. It also thickens the fluid around the cervix, opening to the uterus or womb. This helps to prevent the sperm from reaching the egg. For emergency contraception pill, the morning after pill emergency contraception EC reduces the chance of pregnancy after unprotected sexual intercourse. Common situation in which EC could be used include forgetting to take several birth control pills in a row, having a condom break or slip off, or not using a birth control method during sex. For contraceptive ring, the vaginal ring is a small, flexible, plastic ring that you insert into your vagina to prevent pregnancy. The vaginal ring prevents pregnancy by continuously releasing synthetic estrogen and progesterone. These hormones are absorbed into your bloodstream. For diaphragm contraceptive, it is reusable and relatively inexpensive. It is small and easy to carry. It rarely hinders the sexual experience. For sterilization, many women are forced by their husbands to undergo sterilization for government incentives and benefits. A large number of surgeries performed at once help officials meet family planning targets, but Dr. Betty says they are fraught with danger. The fifth objective is explain the benefits and risks for each form of contraceptives. The first type of contraceptive is the condom. The benefits of it are condoms are effective against STDs. Condoms and internal condoms are the only methods of birth control that also help prevent the spread of sexually transmitted infections like HIV, chlamydia, and gonorrhea. Even if you're already using a different kind of birth control to avoid pregnancy, it's a good idea to also use condoms or internal condoms every time you have sex to protect yourself from STDs. Second, condoms don't cost much and are convenient. Condoms are super easy to get from many different stores, community health centers, Planned Parenthood health centers, and online. You don't need a prescription or ID to buy them, and they're inexpensive or sometimes even free. Third, condoms can be sexy. Protection is important, but so is pleasure. Luckily, condoms offer both. The fourth one is condoms help other methods of birth control work even better. Adding condoms to your birth control lineup can give you extra pregnancy protection. No method is 100% effective, so adding condoms as a backup helps you prevent pregnancy if you make a mistake with your other method or it fails. And it's a good idea to use condoms to help protect yourself against STDs as well. The fifth one is condoms can add extra protection to almost all other birth control methods like the pill, shot, ring, IUD, and implant. Sixth, condoms have no side effects. Most people can use condoms with no problem. There are no side effects. The risks of it are: first, condoms can trigger a latex allergy. Reactions to latex can include rash, hives, runny nose, and in severe cases, tightening of the airways and loss of blood pressure. And second one is condoms aren't foolproof. The second type is the oral contraceptive pill. The benefits of it are: first, it does not interrupt sex. Second, it usually makes your bleeds regular, lighter, and less painful. Third, it reduces your risk of cancer of the ovaries, womb, and colon. And the fourth, it can reduce symptoms of PMS or premenstrual syndrome. Fifth, it can sometimes reduce acne. And sixth, it may protect against pelvic inflammatory disease. And the risks of it are: first, unintended pregnancy. While birth control pills are highly reliable in preventing pregnancy, there is the possibility that you could become pregnant. Second, blood clots. Third, cholesterol levels, migraine headaches, high blood pressure, cardiovascular disease, cancer, and etc. So the third type is intrauterine device or IUD. The benefits of it are: first, IUDs are very effective. IUDs give you great long-term protection against pregnancy. They're more than 99% effective. They work as well as sterilization and the birth control implant. IUDs are one of the most effective methods you can get because there's almost no way you can mess it up. You can't forget to use it like the pill or ring, or use it incorrectly like condoms. IUDs are set it and forget it birth control. Second, IUDs are really convenient. Once your IUD is in, you barely have to think about it. It works until it expires or you have it taken out. Plus, you have protected against pregnancy for 3 to 12 years, depending on what kind you get. You can get pregnant after taking out an IUD. Third one, IUDs are reversible. If you decide you want to get pregnant, you can get it removed at any time. IUDs won't affect your fertility or make it harder to get pregnant in the future. Fourth, IUDs can make your periods better. Hormonal IUDs can cut down on cramps and make your period way lighter. Some people totally stop getting periods at all. Hormonal IUDs can help treat people who suffer from severe cramps, really heavy periods, and anemia. The fifth one is the copper IUD doesn't have hormones. Some people prefer non-hormonal birth control or can't use methods with hormones because of medical problems. Luckily, the Paragard Copper IUD is super effective at preventing pregnancy and totally hormone-free. Sixth one is the copper IUD can be used as emergency contraception. Paragard IUDs are the most effective form of emergency contraception out there. If you get one with it within 120 hours or 5 days of having unprotected sex, it's over 99% of effective against pregnancy. And bonus, your copper IUD can keep preventing pregnancy for as long as you like, up to 12 years. The risks of it are: first, lost strings. The IUD strings, which hang from the bottom of the IUD, protrude from the cervix into the vagina. These strings are left in place when the IUD is inserted, but they can sometimes work their way up into the uterus. Missing or lost. Second, expulsion. Expulsion occurs when the IUD has moved from its intended position at the top of the uterus. This is one of the more common complications and occurs in 2 to 3% of patients using an IUD. The two types of expulsion are complete and partial. Third, infection. One of the most serious complications that can arise because of an IUD is infection. IUD infections are generally a result of the insertion process. If an infection does occur, it can lead to pelvic inflammatory disorder. Fourth one, perforation. Perforation, the IUD pushing into or through the muscle of the uterus, is rare, occurring in 1 to 2 per 1,000 IUD insertions. This typically occurs during the insertion process. If the provider inserting the IUD recognizes a perforation, they will stop the procedure and remove the IUD. The fourth type is the contraceptive implant. The benefits of it are: first, one of the highest levels of effectiveness of all contraceptives. Second, no need to worry about birth control for 3 years. Third, fertility returns as soon as the implant is removed. Fourth, appropriate for women who can't use birth control that contains estrogen. And here are the risks of it. First, abdominal or back pain, an increased risk of non-cancerous ovarian cysts, changes in vaginal bleeding patterns including absence of menstruation or amenorrhea, decreased sex drive, dizziness, headaches, mild insulin resistance, or mood swings and depression. The fifth type is the contraceptive injection. And here are the benefits. First, each injection lasts for either 8 or 13 weeks. Second, it does not interrupt sex. Third, it's an option if you can't use estrogen-based contraception. Fourth, you do not have to remember to take a pill every day. Fifth, it's safe to use while you are breastfeeding. 6, it's not affected by other medicines. And 7, it may reduce heavy, painful periods and help with premenstrual symptoms for some women. The risks of it are: first, there's a small risk of infection at the site of the injection. In very rare cases, some people may have an allergic reaction to the injection. Second, using Depo-Provera affects your natural estrogen levels, which can cause thinning of the bones, but it does not increase your risk of breaking a bone. Third, this is not a problem for most women because the bone replaces itself when you stop the injection, and it does not appear to cause any long-term problems. And the last one, sometimes the doctor may recommend that you stop after 2 years so there's no long-term effect on your bones. The sixth type is emergency contraception pill or the morning after pill. And the benefits of it are: first, emergency contraceptive pills or ECPs help a woman avoid pregnancy after she has sex without contraception. ECPs help to prevent pregnancy when taken up to 5 days after unprotected sex. And the risks or side effects of it are nausea or vomiting, dizziness, fatigue, headache, breast tenderness, bleeding between periods or heavier menstrual bleeding, and lower abdominal pain or cramps. The seventh type is the contraceptive ring. The benefits of it are: the ring is an effective way to prevent pregnancy. If you follow the instructions and use birth control rings the right way, they give you great protection against pregnancy. Second, the ring can make your periods better. Third, the ring is convenient. Using the birth control ring is easy and convenient. It's great for people who don't want to deal with taking a pill every day, or who don't want to use birth control that you have to think about right before you have sex. Lots of people like the birth control ring because it makes their periods regular and easy to predict. The hormones in the ring can also help the menstrual cramps and make your period lighter. Fourth, the birth control ring has health benefits. Side effects aren't always a bad thing, and the ring isn't just for birth control. And here are the risks of it. You may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects, such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. The eighth type is diaphragm. The benefits or advantages are: first, you only need to use a diaphragm or cup when you want to have sex. Second, you can put it in at a convenient time before having sex. Use extra spermicide if you have it in for more than 3 hours. Third, there are usually no serious associated health risks or side effects. And fourth, you're in control of your contraception. There are no health risks associated with using a contraceptive diaphragm or cup if you use it according to the instructions that come with it. And for the last type is sterilization. The benefits of sterilization are: first, sterilization is very effective. Tubal ligation is permanent and one of the most effective kinds of birth control out there. More than 99% effective at preventing pregnancy. Tubal ligation works so well because it's permanent and there's almost no way you can mess it up or use it the wrong way. It protects you from pregnancy 24/7 for the rest of your life. Second, sterilization is convenient. After you get sterilized and the doctor says it's safe for you to have sex without birth control, that's pretty much it. You never have to use birth control again. No trips to the pharmacy, nothing you need to buy, and you don't have to put anything in place before sex. Sterilization is get it and forget it birth control. The third one is sterilization doesn't change your hormones. Some people prefer non-hormonal birth control or can't use methods with hormones because of medical problems. Tubal ligation doesn't use hormones to prevent pregnancy. It won't cause menopause, change your periods, or mess with your natural hormones. Fourth one is sterilization can make your sex life better. Sterilization is birth control that you don't have to use during sex, so it won't interfere with action. You can get cough up in the heat of the moment without worrying about pregnancy, and you and your partner can focus on each other instead of birth control. And the risks of it are: first, allergic reaction to the anesthetic, damage to nearby organs such as the bowel or uterus, infection, inflammation, and ongoing pain, hemorrhage or very heavy bleeding, and infection of the wound or one of the fallopian tubes. We are done with the contraception, and now let's move on for the second reproduction health called infertility. We have here the objective that explain the cause of infertility. Alright, so infertility is a condition where you cannot get pregnant after 1 year of trying to conceive. In women, cause of infertility can include endometriosis. So what is endometriosis? Endometriosis can influence fertility in several ways: distorted anatomy of the pelvis, adhesions, scarred fallopian tubes, inflammation of the pelvic structures, altered immune system functioning, changes in hormonal environment of the eggs, impaired implantation of a pregnancy, and altered egg quality. Second, uterine fibroids. There are several ways uterine fibroids can reduce fertility. Changes in the shape of the cervix can affect the number of sperm that can enter the uterus. Changes in the shape of the uterus can interfere with the movement of the sperm or embryo. Fallopian tubes can be blocked by fibroids. Third, thyroid disease. With hypothyroidism, your thyroid gland doesn't produce enough of certain important hormones. Low levels of thyroid hormone can interfere with the release of an egg from your ovary or ovulation, which impairs fertility. For men with fertility problems may have a low sperm count or low testosterone and abnormal sperm function or blockages that prevent the delivery of sperm. Illnesses, injuries, chronic health problems, lifestyle choices, and other factors may contribute to male infertility. The risk of infertility increases as you age. So that's all for my topic, and the 3 more remaining objectives will be discussed by Miss Saling. Thank you and have a good day.